root tears, I think were really underappreciated for a very long time. As was mentioned, if how much cartilage wear is too much, that's still a debate. But osteoarthritis can progress very quickly in these patients. So I would suggest if you see a patient and it's been more than 3 months since they've had their MRI, re-image them, because you can see some catastrophic these tears. So number 2, I think in every case you need to pie crust the MCL. I think it's easy, and I'll show you there's data that says it doesn't make any long-term difference. I think a medial notchplasty can be helpful, but most important, you really need good visualization. The last thing you want to do is cause more damage to the knee. When you do, once you got a good view back here, I think you need a good surface to heal it to. So taking a curette, and different companies have sets for root repair that come with a special curette, but any curved curette can work. You basically need to have a good bony surface to heal it, but you also want to be able to see the pin as you start drilling your pin. You really need the right equipment. And so when I started doing root repairs, all I had was an ACL aimer. And the problem with the ACL aimer is that it takes up a lot of room, and I think you have to do a larger medial notchplasty. But if that's all you got, ask for the ACL, the pediatric ACL guide, because at least the little hook is a little bit smaller. There you can kind of curve around the tibial spines. Multiple companies make these systems, and multiple companies also make an aimer pin here that has a sheath. So Arthrex, Smith & Nephew, a number of different companies make it so that you can essentially drill and be able to see what you're doing. So here you can see the cannulated tip coming through here, which allows you to then pass a suture. As far as getting posterior, as I mentioned, the ACL guide is difficult, but a cannulated reamer makes everything easier. Here you can see passing this loop. You can also pass a stiff fiber stick. Anything is fine as far as getting through, but you need to make sure you've cleared off that soft tissue and bone, or you're not going to be able to see. So as far as the suture passing, I recommend drilling the tunnel first because you have better visualization, but you can use different kinds of reusable suture passers. I like using suture tape because it's stronger. As Nick mentioned, these sutures aren't necessarily strong enough for your suture to cut through that meniscal tissue. There's also the Terex, and you can pass with these single-use suture passers, and this has actually made this procedure, I think, much more reproducible. Here you can just see, so you can pass essentially a mattress and then bring it through like a luggage tag, which can really make for a better repair. I typically pass with 2 sutures. I also like to mark the sutures with pen, just so I know which ones I'm pulling on to get adequate tension because I'm outside of the knee. Here's just with a knee scorpion, you can see passing a loop suture or a link suture tape here, which it can also be a very good option. When you shuttle the suture through the tibia, again, I pass the monofilament first, and then I'm able to pass my sutures back through. You can see here it's nicely cleaned off.
Oh, set.
And really, you need to get the right equipment. Here you can just see shuttling the sutures. Quick case, 57-year-old, stepped off a ladder, felt a pop. Here you can see a clear tear. The radiologist did miss this one. Another 44-year-old female, very active. Securing your sutures really doesn't matter, but you can use a post, a button, or a footprint anchor. Here you can see marrow venting, extremely important. I think I'm out of time, but here you can see there's good data that the outcomes of microventing are better. You don't have to use PRP and add cost to your procedure, but significant reduction in failure. Right, Seth, you can cut me off.
We will.
Just another study showing that in goats, microventing really helps as well. And I think if it's good for a goat, it's good for us. I think that PRP is fine, but it just adds cost to your procedure. And I think it's important to keep these patients with very limited weight bearing since they're overweight. In many cases, we do use Xarelto in most patients to prevent DVT in these type of injuries.